streaming everywhere, and we are live. Hello, Dr. Hiba Injibar. You are a Harley Street dermatologist, and we are here tonight to discuss skin, aging skin, menopausal skin, all of those sorts of horrible things. And now, this is going to sound like the world's longest introduction, but just so people, just to paint a picture of what happens to us during this period of time. We have something like a 30% reduction in collagen in our skin during, or in the lead up and around menopause. After menopause, we have about 2% reduction every year. And if you're wondering what that does, that scaffolding is the thing that sort of holds your skin. It's a scaffolding of your skin that sort of gives you the texture. And we also lose hyaluronic acids, which means that we lose sort of volume and plumpness as well, don't we? So the big questions are, what can we do about it? You see a lot of women around my age.
Yeah.
When they come in, what are their main concerns?
Some women know what they want. So some women know that they want, they don't like their eyes, or they don't like the lines here, or, I don't like the texture of my skin or my saggy jaw lines. And some of them, they're like, when I'm looking at the mirror, I don't feel comfortable anymore. I feel like I'm aging, or I feel tired is a common thing. And what can you do to help me look fresher, help me look better, and give me more self-confidence? And normally I give them the mirror, because this anytime we're dealing with cosmetic dermatology, and it's about them, it's about the patient, it's about what they see, rather than me throwing everything I can do at them. I normally give them the mirror and tell them, before I tell you what I recommend, if you look at the mirror, what is it that just annoys you most, if you know? And sometimes, yes, then when they look, they would say, oh, it's the fact that my eyes look so tired, and everyone keeps telling me you're not sleeping well. Or they would say, oh, I don't like the fact that my skin is so blotchy, or my lips have become so thin, and every time I put lipstick, it bleeds. So then we can just narrow down, and I would target my recommendation to what is annoying them. And then, of course, I would then, recommend other things that they might not have thought about. For instance, what is your skincare? Are you using products that are suitable for your skin, for your age, to boost your collagen? What about these blotchy spots? Or maybe this is what else I can do to improve your saggy lines. And sometimes, a lot of the times, they might think this helps their problem. For instance, they would say, I have these lines here that really annoy me, and I'm thinking laser will help them, or fillers. And I would then direct them to what will actually help it, rather than just saying, yes, okay, let's do the laser. It doesn't work, then you need anti-wrinkle injections. So that's how I conduct the consultation, and that's how I advise them.
All
So
right,
it's more patient targeted.
there's a lot to unpack there, and some of it touches on one of the questions that came in, and that is, if we have a skincare regime, A, why are they so complicated? And B, you said about the products that people, are you using the right ones for your skin? So one of the main things that women, as they start aging as well, especially particularly, women who have rosacea and pale Anglo-Saxon skin like mine, is that we find our skin becomes drier, more sensitive, and if you have rosacea, that we're more prone to flare-ups.
Yes.
What can we do about that? So if we're looking for skincare, what would help?
So if the skin is getting drier, more sensitive, or showing signs of rosacea, as in flushing every time they run or exercise or get out of the hot shower, or if they drink wine or eat spicy food. So if there is an element of rosacea, I would put them on specific skincare. I would steer away initially from things like retinoic acid, retinol, and even vitamin C, until I can make their skin more tolerant. So I'll put them on uh, um, products that normally work for rosacea prone skin. including a very sensitive redness prone cleanser, a good moisturizer, an anti-redness moisturizer. I stress the use of sunscreen, and I put them on Sulantra, which is a medication called ivermectin. In fact, I was at a congress today, and there was a big talk about Demodex. Demodex is a mite that lives in our hair follicles. It's a mite. It's a bit scary. They showed us a video today, which is funny. And if I can get hold of that video, I'll send it to you because it's really funny. How it shows that the Demodex is an actual mite that is very microscopic. It lives in our hair follicles. And in patients with rosacea, it multiplies. So it's the numbers are so vast that they cause this irritation. So using a medication called Sulantra, which has a substance called ivermectin, will lower the concentration of these mites, so their symptoms improve. And most of the time they do very well. And then I also offer IPL because that can help the vascularity, that
That's a
flushing.
laser, yeah?
Yes, a specific laser, IPL, intense pulse light, which has a specific vascular filter. So this is light that helps tremendously with the flushing and the redness and the broken capillaries. It's very easy. There's no downtime. There's no pain. There's no need for anesthetic. And I do it for them like once every 3 or 4 weeks. And that reduces the redness dramatically and the sensitivity as well. And
Do we know, just before we, with the mite, I mean, this is a strange question maybe, and you'll look at me because you know I like to join dots, and sometimes I'm joining the wrong dots. But is there any relationship between changes in the skin pH level and their proliferation? Is it a skin barrier function thing, or is it a pH thing, or we just don't know?
No, well, it's not. It's not about skin barrier or pH. They just, I don't know. They multiply. We had an hour, 2 hour talk today with dermatologists, and there was a specialist talking about it. No, there's no relationship to the pH, and it's just like in acne, the bacteria for acne propionibacterius multiplies, and this is a multiplication of Demodex, and it causes sensitivity with these symptoms and rosacea, and they dramatically improve on the topical treatment, appropriate skin care. I tell them avoid harsh things, avoid scrubbing your face. And then after I've been treating them for a while and we've done the IPL and they're okay, I start then introducing anti-aging slowly. So I'll start them on vitamin C, and then maybe slowly start low concentration of retinol twice a week. And normally, some of them can tolerate it, and others it flares their disease up again. So we just stop it. So play it by ear. But most of them tolerate at least vitamin C.
Okay, now, so on the anti-aging, since we've now beautifully segued into that, what are the main things that people should be looking for, and what should they not do, and what should they definitely do?
You mean in products, in skincare? You
mean?
Yeah. So don't go to, I've said this before. I don't want to sound prejudiced, but don't go to places that just sell makeup and clothes and everything, and then speak to someone and who's not medically trained, not a pharmacist, not a nurse, not a doctor, and buy 5 or 6 products that costs you thousands, and honestly they will not work. The reason being, they're marketed and sold by specific people who don't know exactly what is in them. At least if you don't want to see a skin specialist, at least go to a pharmacy and look for specific ingredients. These creams will be, even if you go to Boots and look for these, they will be more medically tested, less expensive, and they actually work. So the ingredients you should be, and I put my patients in a certain degree, almost all of them eventually on these products. Of course, a good gentle cleanser, a good moisturizer that suits their skin. I usually resort to the medical grade ones, like the medical grade products according to their skin. If it's dry, I'll give them a rich moisturizer. If it's oily, I'll give them an oil-free moisturizer. Vitamin C, I give to everyone. It's antioxidant. It boosts the collagen. It improves pigmentation, prevents pigmentation. And I tell them to use it in the morning under their sunscreen. And then the other active ingredient I love is glycolic acid. It's amazing. Once the skin tolerates it, it keeps your skin smooth. It works on pigmentation to treat it and prevent it. And it massively boosts collagen. And it's not as irritating as the vitamin A products. And these, I put them on in the morning under their sunscreen. At night, I start them according to how well they can tolerate on one vitamin A derivatives, whether it's retinol or retinol or tretinoin. And the highest in those category is the tretinoin 0.1%, which is the strongest. And I have a lot of people who tolerate it and use it, because once you get your skin used to these products, unless you have eczema or rosacea, the skin develops tolerance and it doesn't irritate anymore, even if we go to the highest concentrations. So that is basically what I tell them and I give them as far as products. And
So vitamin C, glycolic acid, retinol or retinol. The in terms of those kinds of things, vitamin C is ubiquitous these days. You can get it all over the place, but it's a highly
volatile
molecule, isn't it? So in terms, if you were looking for something, would you be recommending something in a light proof, airless container, or what you would be looking at, and what concentration? Because that's the other thing that's important.
Yeah. So they normally come as 10% or 15%. Some companies go up to 20%, like SkinCeuticals. And it is very volatile, and it's very sensitive to the light. Let's say it's not volatile. It's not evaporating. No, it's sensitive to light. So the way it's manufactured and the way it's packaged is very important. So the ones that I normally recommend to my patients are like 3 or 4. I love the ESK. We started using that. The Obagi ZO products or the Obagi Medical, the SkinCeuticals, and then the Neostrata have a 15%. These are, you're getting what it says on it. So if it's 10%, you're getting 10%. If it's 15, you're getting 15%. And some of them, if they're drops, the bottle itself is very dark. And if they're tubes like the ZO1, it's just a pump. So there's no light that goes in. So that's very important. Not any vitamin C on the market works. No.
Interesting that. Keep talking for 1 second about vitamin C because I'm going to grab, I've got an old one that has, so people can see what it looks like when it goes off in comparison to what it's like. Because I think this is really important, because if you keep on using it when it's turned a nasty color, it's hang on 1 second.
Okay.
All right. These are, so this one is a nice fresh one, and I don't know whether or not you can see this very well, but hang on, where are we? Where's my hand? Where's my hand? What am I doing? What am I doing? Where's my thing? Oh, I'll put it in here.
Yellowish, isn't it?
It's actually, I can't get it in there. That one is nice and clear. So that's a nice fresh one. This one, which expired in September 22, you will see in a second, is, where am I? About to drip it on the thing. See that? It's a nasty yellow. So if it's got a nasty yellow, it's had it in the bin.
It depends on what the original color of it was. So some of them, they are yellowish, but let's say if they turn brownish, then they're off. And if it's clear and it turns yellowish, every time your creams change their color or they become granular, then that means, get rid of them and use a new one.
Yeah.
And I don't like a lot the tubs like cream where you insert your finger and get eventually it will get contaminated. I feel you might leave it open. So pumps are always a better way of manufacturing creams, or tubes that you
Things you're
squeeze.
not sticking your fingers into and don't have any air or light.
Yes, yes,
Yeah.
exactly. So
Yeah.
it becomes a bit contaminated.
Yes. The you mentioned pigmentation in there as well. So what is it that makes our skin start to become pigmented as we get older, and what can we do to prevent that?
So two things: sun and hormones. If we're talking about melasma, there's an element of hormones involved with the sun that cause this pigmentation. But there's another type of pigmentation that is not hormonally induced, and that is what we call photo damage, or which is blotchy pigmentation that is due to years and years of sun exposure, unprotected sun exposure, where the skin becomes rough, actually rough. So that's one of the, when I'm examining the skin, one of the things I look for is how smooth the skin is. But in photo damaged skin that hasn't been really well taken care of in case in using products over years, is actually rough, and that is because that dead skin layer has built up, and that causes it to become dull and rough and pigmented. So there will be blotches of uneven pigmentation, sunspots that look like freckles with different sizes. And sometimes they even become thick. So they're not only flush with the skin, they have a little texture to them. So these are the types of pigmentation. How we treat them, um, I use lasers a lot, not for melasma. Melasma, I resort to, medical treatment, creams that block the tyrosinase, peels like Cosmelan peel, and I shy away from lasers for melasma. And sometimes tablets, we can prescribe some medications if they don't respond. Sun damage, on the other hand, and photo damage, I put them on a good cream regimen, and I offer lasers because they work. I have different lasers that work for different indications. So I can treat their brown spots with the Q switch laser. I can do resurfacing with either the CO2 or the non-ablative fractional laser, or also chemical peels. But it depends what they have.
Yeah.
So
A
I'm a
lot
laser, so I do lasers a lot.
of you did a full disclosure here. You've done my hands, and that made a very good difference. And I also sent you my husband because
Oh,
because
yes.
yes, he had a very large sunspot here, because he has his entire life refused to ever wear any sunscreen, despite moving from Russia to Australia with me. And I was going, "You've got to put your." By the time I'd actually learned to wear it, you've got to put your sunscreen on. I was like, "No way! I haven't had enough sun in my life." So, giant, great big. It was quite
Yeah.
large. Wasn't it? It was really about that big.
It was like a 5p size, and
Yeah,
one session, was it? One session or
one
two
session. And
sessions?
so, explain to people how, because I think people, when they hear laser, they think, "Oh my God, you're going to burn me and I'll be disfigured for the rest of my life." So explain for pigmentation, what does it do and how does it do it?
So the Q switch laser, which works for pigmentation, freckles, sunspots, tattoos, birthmarks, brown birthmarks, some birthmarks, of course. There are lots of birthmarks that I do not treat with laser because it's not safe. But if I've tested the birthmark and I've confirmed that it is safe to treat it with laser, for example, a cafe au lait spot, or tiny, tiny little moles, like really tiny millimeter size moles that I'm sure are superficial and safe, and I've examined with my dermatoscope. The way it works is that we don't treat the whole skin like other lasers, like the CO2 or the erbium laser. It targets the individual spot only. It's relatively painless. Sometimes I put a bit of numbing cream. Most of the time it's just with the cool air jet, that's fine. And it kind of splatters the pigment in this spot. So the spot is as small as 3 millimeters. So I can target a tiny 3 millimeter lesion without affecting the surrounding skin. And the downtime is that spot, whether it's a freckle or a birthmark or whatever I'm treating, turns darker and a bit rough, and then it peels off within a week. And for superficial spots, it's just normally one session and they're gone, and there's minimal side effects. Sometimes if the skin is dark, because I treat a lot of darker skin individuals, I would do a test patch to make sure that when that brown spot peels off, it's not leaving behind skin that's whiter than their normal skin. And if it's fine, then we'll do it. I always advise them sunscreen. uh I always advise sunscreen, but I mean, especially after, and don't do any laser and then go travel to Hawaii and sit in the sun, or Mauritius. So, avoid intense sun for a week or two afterwards.
Yeah.
And it works really, really well, and it's easy.
Yeah. And in terms of, is that a permanent solution, or over a period of time, would you find the pigmentation would start to come back? So would it be sensible then to make sure you had an anti-pigmentation skincare regime?
That is why I said it depends on what is the pigmentation. If it is melasma, I do not treat it with lasers. Uh, because it will come back. So they have to be on anti-pigment creams. If there's a stubborn, really small spot, I would treat it, but I'll tell them it will come back. If we are targeting sun damage or like your husband's spot, no, it's permanent, or freckles, it will go completely, it will not come back because we're permanently removing that. Same holds for, let's say, tattoo. There are some birthmarks that I sometimes treat with the laser, like cafe au lait macules. These, respond really nicely, but I tell them there is a tendency for them to come back, maybe. And we cannot predict that. And even if you put them on anti-pigment creams, that's not related. It's not going to prevent it. But they know, and they're happy to do it. Normally they don't come back to me, except rarely, to redo it. So it depends on the cause of the pigmentation, is to answer your question.
Yeah. 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 It's an interesting one. Pigmentation is a very complicated thing. With just going back to sort of treatments then for aging skin, that's the other, because often you can use lasers as well, and other types of radio frequency or ultrasound and things like that. How do they work, and what do they do?
So ultrasound, which is called HIFU, or high intensity focused ultrasound, these ultrasound waves go penetrate the skin, so they don't really affect the surface of the skin, and they go deep to heat the skin, the deeper layers of the skin, and boost the collagen. And this way they can work on tightening. So we use them for tightening the skin, improving or preventing jowling. They can even be done around the eyelids, on the neck, on the tummy. And this is how they work. So they will not touch the surface of the skin. They go deeper. Normally, first we do one session, 3 months later, a booster session. And the results, it's kind of what we call skin tightening. Is the results are gradual. You don't see them immediately like when you do Botox. It's a gradual process, but many people are happy with it and they see results. I've done it myself, and I see that results, that gradually it tightens. Of course, I always tell them this is not a facelift. This is a non-surgical, non-ablative, zero downtime procedure, lunchtime procedure. So realistic expectations are always important. And
Yeah, and I think that's the thing too, is because it is gradual. You hear a lot of people say, "Well, I had it and it did nothing." It's probably quite important for people to take pictures before they have it and then compare it 3 or 4 months later.
We always do pictures, always do pictures, standardized photos, so they see the difference when they come back after 2 sessions. Then you have your lasers for resurfacing. We've talked about the Q switch for spots and pigmentation. For resurfacing, I use maybe like 3 different lasers. One is the ablative CO2 laser that I use for resurfacing, for boosting for improving wrinkles, and also a lot for scarring. That is ablative. That means it actually punctures the surface of the skin. I don't need to do it all over the face all the time. So if I'm targeting, I can only do it, let's say, around the mouth. If the lady is really bothered by the vertical lip lines, I can do it only around the eyes if I'm targeting the eye wrinkles, or we can do it all over the face to tighten the skin, chest, and the intensity of it, I can vary. So I can be superficial or deep if I'm treating scars and deep wrinkles, and that has downtime. So I prepare them a lot with different creams, and they take time off, and that requires a week of, but we follow them very carefully. We give them post-care instructions, so normally they do really well, and I do that procedure a lot. The other is the resurfacing laser that boosts the collagen, improves the wrinkles and the scars, is non-ablative, which means it leaves the surface of the skin intact, and the laser beams penetrate deep to resurface. That has much less downtime, so they're just red for a day or two. They can wear makeup from the second day. It's not as intense as the CO2, but it still gives result, but with more sessions, and it does improve wrinkles and scars and boosts the collagen very nicely. But it just requires more sessions to do it compared to the CO2. So whereas the CO2, I usually do it every 2 or 3 months, this one we can do every month. And it gives really nice results. And with both of these, we put topical anesthetic on the skin, so it's quite bearable.
Yeah.
Then I can combine the non-ablative fractional with some IPL or intense pulse light, so utilizing 2 lasers to get rid of the redness, the broken capillaries, boost the collagen. So these are the lasers I use for resurfacing, and that's the ultraformer.
With you mentioned eyes there, and the other area that the other area that many of us, when you get to my age, darling, start to worry about is, especially the zoom neck. I mean, for God's sake, the turkey bit under here, this sort of crepey bit, and then the eyelids. Can the laser treat those areas, or are they too sensitive and you're sort of more on the periphery of them?
No, of course it can treat them. Can treat the neck, and it can treat the eyelids. All of the lasers I mentioned treat the neck and the eyelids. I would, of course, vary and the ultraformer, the HIFU as well. Commonly, it's done neck and face. But of course, I would vary the depth, the intensity, the power. And when we're doing laser around the eyes, especially the CO2 laser, I would put intraocular shields. So they're like your contact lenses, opaque. So they protect the eyeball, so we can be working on the eyelids. But with the HIFU, the ultrasound, there's no need because it doesn't damage the eyes. So it can be done around the eyes with no protection. So everything can be done anywhere. So hands, chest, neck. And one other thing I do for the neck, so there's the skin boosters we didn't talk about, like the Profilo, that helps. And also Botox. If I ask them to tighten their neck muscles, and if I see that the neck muscles are tight and they're pulling, I can't see it here. it might be this platysma muscle. If it's tightening and pushing the jawline down, Botox in the neck and the jawline gives dramatic results because it relaxes that muscle, so everything springs up. So yes. It's a combination. It's always a combination, and I always give them, like, there's nothing that fits everyone. I just give them a targeted protocol for them specifically.
Yeah, you mentioned just before we get onto the skin boosters, the you with those laser resurfacing and either the ablative or the non-ablative, any type of skin okay with that, or is it only for people with fairer skin?
No, not every type of skin, but it does not have to be type 1 and 2 like your skin or my skin. I do treat darker skin tones. Not, of course, we're not talking type 6, which is like the black, which is the end of the spectrum. That I don't treat with lasers. That's too dark. But up to type 4, sometimes some type 5 people, if I prepare their skin well, do test patches, give them some hydroquinone before and after. And I do treat them, but I don't, of course, the fair skin tones tolerate it much, much better. The only thing we're worried about is post-inflammatory pigmentation. And I always tell them and I warn them. And even for lighter skin tones, I still do test patches all the time with the CO2.
Yeah.
Because that's the one that has a higher propensity of causing pigmentation.
Yeah. Now it's been a long time since I've discussed skin and those sorts of things, and there are so many since I last talked about these things. There are so many of these new skin boosters with nuclear polypeptides and God only knows what else in them. What do they do? What do these skin boosters do, and how do they vary from what we would normally think of a volume filling filler?
So skin boosters, they are the ones I use, which are still safe and tested, and they've been on the market for a very long time because that's how I like to practice. I don't jump at new things unless I'm 100%, like 200% sure how they work and their side effects. So they're a very low concentration of hyaluronic acid, which is the same one that's used to volumize, like your fillers, but it is injected in minute amounts and spread under the skin in the second layer of the skin, so what we call dermal, in the dermis, and they hydrate the skin because hyaluronic acid gives a good hydration. So the skin becomes softer, well hydrated, and they do boost the collagen all over. So rather than, let's say, the lips or the cheeks or the jawline, you're just spreading that hyaluronic acid under the skin, hydrating it, boosting the collagen, improving the texture of the skin. And I normally use two of them. I use the Profilo, which is very well known, and Profilo is easy because it does not involve a lot of injections. So 5 injections for the cheek, 10 injections both, 5 here, are enough. Easy, no pain, and then it spreads. And it can also be done on the neck, on the décolletage. I don't do a lot of body treatments, but it can be done on the hands as well. And then I use the Restylane skin booster. I like that because the syringe itself has a mechanism to allow you to inject a certain calculated amount with each injection. So it click, 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 it clicks. And that, in contrast to Profilo, I can use it anywhere. So I can inject under the eyes, I can do the forehead, and I can spread it all around. So these are the two boosters I normally use. I know there are new things like exosomes, etc. I don't have a lot of information about them. I don't really use them yet. I'm going to Paris in February. There's a big meeting that happens normally once a year in Paris. It's called the IMCAS. And in that they discuss new things. So if I learn that they're safe and they're good and I hear them and I'm convinced, then I'll introduce them to the practice.
Yeah. Because when people say, "Well, and we've added peptides and we've added this and we've added that and we've got a bit of this,
Like,
that," and I start thinking, "Oh, I don't know," but that's probably, I'm very ignorant about these things. Everybody goes, "Oh, no, they'll be fine." So I'm sure they're probably, yes, I'm a bit like you. I'd like to see them used for quite a period of time before I make up my
I'd
mind.
rather stay safe, and I've seen complications. I've never done myself, I've never practiced doing mesotherapy because I was never convinced that if I'm injecting I don't know, a cocktail of vitamins and substances under the skin, that it's doing something. So there's no real science base behind it. So I've never really liked it or done it. Of course, we can do if we know what we're injecting. That works. But if it's just a cocktail of things which you don't know what it's doing. I'd rather stay.
Even if there is a benefit, you don't know if the benefit was from the microneedling that put it there or from the actual things that you put in with the microneedling. So it's hard to work out where the benefit really came from.
Yeah, exactly. And I've seen, and my colleagues have shared also, because we do share a lot, and I'm on a group of dermatologists. They're all my friends, but they're from all over the world. And I remember recently one of them shared and said, help me with this. This patient had done mesotherapy using a certain cocktail. She didn't do it. The patient was coming to her for help. And they had like tiny little nodules all over their face and their neck, and which were hard. And it turned out that they were injecting, it's not silicone, but it's a substance that's close to silicone, and it's very difficult to get rid of. And these are everywhere. So when you see complications, even if it's 1 in a million, and you're also not sure about how it works and what exactly you're doing, for me, I would stay away from it. I mean, some others would practice differently. I'm not saying that the procedures I do don't have side effects or the medications, but it's predictable, and you know what it's doing, and then you can treat the complication. So if there's pigmentation from a laser, I can treat it. But if there's a complication which I'm not sure what it is, how I can treat it, so I'd rather stay away from it.
Yeah, that's an interesting one, isn't it? Because, I mean, there needs to be regulation, doesn't there? I mean, if people are putting, I cannot imagine why anybody in a mesotherapy would put anything vaguely even close to a silicone in it. But you've got to, yeah, so basically always go to a trusted and reputable practitioner and know what it is that they're putting in you. Yeah. Wow. That's kind of scary stuff, isn't it?
Yeah. And I remember we kept saying, inject them with steroids. And she said, I tried, they don't go away. So some complications are very difficult. It's like in the old days, 20 years ago, some doctors or practitioners were injecting permanent fillers. And I've never used permanent fillers because they're like plastic beads and they stay in your skin forever until you die. But it means that you don't need to repeat it because they don't dissolve. And I've seen horrendous complications from them, like nodules, lumps, infections, and sometimes they get infected 10 years later.
And also, why would you, I mean, as we going back to the aging face, as we age, the fat pads move, the bone structure changes. If you've got something permanently, that may have suited you when you were 20, by the time you're 45 or 65, it might look be in the wrong place and look completely wrong.
Yeah,
Wow.
yeah. Luckily, they're not there. I don't think people use them anymore. I don't know, but yeah, I've seen bad complications from
Yes,
the.
you have. Yep. Ooh, there you go. And speaking of Paris, congratulations on your award. Tell us about the award that you just won.
So it's called the European Awards in Medicine, and I won the category for dermatology, and DermaSurge, my clinic, won the category. It's their awards that are assigned for different fields in medicine. And there were either people winning awards there for research, for other, it's all in medicine. And it was nice because we won the award in April, but we knew about the award that we won, and I won in April, but the event was in Paris in November. So I went with the team, and it was at the Ritz, and it was really nice, very well organized, and now we have the trophy in the clinic. So
Well,
it was really nice. They're very well organized. All doctors, different specialties, endocrinology, surgery, ENT, some, and one per category only. So it wasn't like,
yeah.
thank you.
That is a very, very impressive thing indeed. Indeed. Let me hit you with a couple of the questions that came through. One was, this is the other thing, I mean, this is a more of a body question, but the one lady sent a picture of her armpit that was a very nasty red rash. I found, as you know, people may have heard me whinge about this before, but you know, many years ago, my sister said to me, "I can't wear a bra anymore. It's too painful under the boobs." And the number of women that I know who say, "I can't wear a bra anymore," and then I got to the point where I thought, "Oh my God, I can't wear a bra anymore either." And so what is causing these rashes, this itchiness, especially in sweaty areas, and how do we fix it?
It's candida. Candida is a fungus. It causes itch. It loves the heat and moisture, so it typically grows in areas that are moist. So typically under the bra, under the arms, in the groins, and it can also spread to the tummy or elsewhere. It typically gives us the thrush that a lot of women get, vaginal thrush, when they take antibiotics or at certain times in their cycle. And it causes red patches that are extremely itchy. Sometimes it gives little pustules, like little pus-filled blisters, and some scales. And the way to get rid of it is to use antifungals. So you can buy antifungals over the counter. You don't need a prescription for antifungals like Lamisil cream, Canesten cream, Dactarin cream, and keep the area dry. And keep the area dry. They like moisture. So if you sweat a lot, or if you go to the gym and you sweat, immediately shower, get rid of that sweat. If women are a bit overweight and if they feel there's a lot of friction, so I tell them to put a kind of thin cotton flannel under the bra, so then the bra is not rubbing, and there's a cotton flannel, so it's absorbing the moisture. And wear cotton clothes. Stay away from really clothes that make you sweat, especially in the heat, not now. So it typically grows more in hot weather, so when we're hot, when we're sweaty.
Yeah.
If it does not respond, then they would need some oral antifungal tablets instead of just the cream, but
Yeah.
most of the cream works.
It's a difficult one because I think, because I did this and then because I got to the point where I can't stand this any longer. Because the worst thing is, I mean, you make it worse because you think I can't wear a bra, but then of course, you know, when you're getting older and everything's heading south, you're making it actually worse because they are sitting on top, two bits of skin sitting on top of each other, getting hot and sweaty and rubbing together. So you do need to actually get something that lifts them up, but it's too uncomfortable to wear something to lift up. And also, most of the bras, as you say, are not made from cotton or anything like that. Even the sports ones, they're thick, they're heavy, and they're uncomfortable. So we really need new bras.
You can wear a cotton vest, like these white underwear cotton vests, and then wear your bra on top of it.
Oh, oh,
Nice
oh,
tip.
like
Yeah.
that. Yes, that is.
Yeah.
That's
Instead of wearing it on after your bra, wear it underneath your bra. So that way, your bra is not rubbing. You have your vest, which is 100% cotton, and that works as well.
that is a clever tip. I like that. But all the better to just get rid of it in the first place. And does this mean if you're prone to this, are you going to have to continue using Lamisil or Canesten for, you know, pretty much, because it will happen again, won't it? Is it sort of like a lifetime treatment?
Not a lifetime. Once you eradicate the fungus, I mean, that fungus lives on our skin normally, but it's the numbers are very low. The concentration is very low. So if it multiplies and causes the infection, same like what we talked about in Demodex, you treat it, and then maybe you can use it like once a week, apply the cream once every 10 days, and then you keep it under control. And like what I mentioned, avoid sweating and overheating and wear cotton. So that helps it.
Yeah.
If thrush with candidal thrush in the vagina, if you're taking antibiotics, it might come back. So you can get these. They're also over the counter. I don't think they need a prescription. The antifungal pessaries, and that eradicates it. So you don't need to keep using antifungal pessaries all the time. No, but when you get that thrush, you use it, and that gets rid of it.
All right. Question here from Sarah asking, what's your advice about red light therapy for skin rejuvenation? Does it work, red light therapy?
No, what is red light therapy? Lasers? Does she mean
LED.
hmm? LED?
LED.
No, there's not a lot of science behind LED. There's not a lot of science. You can buy lasers and lights, but they don't really do much on your skin. It's more lasers, photodynamic therapy, but that's left for medical diseases, not for rejuvenation, and intense pulse light, which is the IPL. These are the lights that work.
Yeah.
Not, I don't. There's not
For
much.
acne, a lot of people say that light therapy, LED for acne.
Not really. Blue light. There's a the blue light is that works for acne. It I in my in the IPL machine that I have a filter that filters. I think it's 755 or something, and that filters or 600 something nanometers, and that gives blue light, and that works on the acne. Yes, I use it supplementary to medical treatment, sometimes, not all the time, when patients want quick fix and it works, the blue light, but not the LED.
All right. Going back to the questions that we had in here before, a woman with itchy feet. Now, she didn't give a lot of detail about itchy feet, but are there various, obviously fungal infections as well, but are there any other things that could cause feet to be very itchy?
If normally it's fungus, unless she has, normally it's athlete's foot, especially like she didn't say where the itching is. If it's between the toes and they're smelly, that's athlete's foot, that's fungus. And she can use what we talked about and keep them clean and dry. Sometimes I tell them to dry in between their toe webs using the hair dryer, not on hot, on cold air. If she has itching elsewhere and she has like red patches, it could be eczema, but normally eczema will not localize only to the feet. So if it's just the feet, I don't know, it's probably unlikely. um, Psoriasis can cause itching. What else? Yeah, basically these are the common things that might cause itching in the feet. So it depends what she has, how it looks like, where is it on the feet, does she have it elsewhere on the body. If she has itchy, dry patches on her feet and also on her arms and her hands, maybe that's eczema.
And so there was another woman there that said that she has the intense itching on the arms, and it feels like something is crawling under her skin, which would, if we were talking about menopause symptoms, we'd call that formication, with that feeling that you've got ants crawling under your skin and you just want to literally itch your skin off. Why does that happen, and what can you do about it?
So if it is on one side, like unilateral, and if it's, let's say, arm or scalp or face, and there's nothing on the skin, so the skin looks completely normal, it's well hydrated, there's no redness, no rashes, nothing. The first thing, before I say this is menopause related, I would make sure it's not neurological, so a neuropathy, so the nerve is irritated or trapped somewhere, and that can cause symptoms of itching, especially if it's on one side. So that was something we need to make sure is not happening. Um, and sometimes they would say, I have nothing on my skin, but it itches like crazy. But that skin is dry. So dry skin is extremely itchy. And it happens more with menopause, of course, also in the elderly, or cold weather. So hydrating the skin sometimes will solve the problem. If it has not reached the stage of eczema, if it's just dryness, it can be intensely itchy. So then if they moisturize, use special moisturizers for really dry skin, unperfumed moisturizers, uh, maybe take some antihistamine before going to bed, not overdressing, especially if there's heaters in the room, if the room is heated, and if they're wearing if they're being covered with a thick blanket, don't wear thick pajamas, because then your skin will overheat and you start itching at night. So heat as well. So wear something thin and cottony. And again, today I was at a big dermatology congress, and there was a big talk on, interesting talk on scabies. And I'm not saying that lady has scabies, but there's an outbreak, and I'm seeing at the clinic cases of scabies, and it seems there's an outbreak. So scabies is causes intense itching to the point that you need to cut your skin, and especially at night. So if this is something new and it's everywhere and it's at night, and especially if there's other family members itching, so then as dermatologists we look and we think of scabies and we treat it if we suspect it can be sexually transmitted, and then it spreads everywhere and it contaminates everyone.
Great. Isn't it normally scabies sort of like in folds, like wrists and sort of in elbows and things like that? Is it?
It's typically between the fingers, but it can be anywhere. Tummy, um, uh, uh, everywhere. They itch everywhere. I mean, they're cutting their skin apart. They're itching everywhere, genital area. But typically, they can start between the finger webs. That's where it starts. So they like really, really itchy here, and then it spreads everywhere. So
Nasty. But quite easy to get rid of, yeah, scabies. It's not that difficult, is it?
yeah, you need to, you give them topical treatment, sometimes tablets, and it's easy to get rid of if you follow the guidelines. You need to follow the guidelines and treat the whole household. Otherwise, you can keep getting it back.
Yeah.
You need to
All right.
wash.
Sorry? The last.
There's guidelines that patients need to follow. They need to wash all their bed sheets every time they apply the medication. They need to hoover. They need to treat the household. So yes, you can get rid of it.
That is, yeah, a lot of mucking around. Last question I had, and this is always the controversial one, was collagen supplements. Yes, it's a difficult one, isn't it? Because it's, some people swear by them, but is it because they've got other things in with them, or I mean, others sort of say, as Dr. Ginny says, if a collagen supplement works for you, then there's something very wrong with your gut because it's a huge molecule and it was going through, you're in real trouble. So I don't know. It's a difficult one, but no, you're saying.
Yeah, no, maybe placebo effect, or maybe they're taking the collagen and at the same time started using good skincare. So they saw the result and they thought it's from collagen. There's no way it's going to get through your intestine. So collagen, like she said, is a big molecule. It cannot go through it's broken down by your stomach acids. It cannot penetrate. It will never reach your bones or your skin or your hair. And honestly, it's just nonsense. But a lot of people take them, they buy them, they spend money on them, and they don't do anything. So collagen is manufactured in the skin. That is why all the creams that we apply, the lasers, the boosters, the hyaluronic acid, are pushing the skin to make better new collagen. They're not giving it collagen. In the old days, there were collagen fillers, so bovine collagen instead of hyaluronic acid. When I first started doing fillers or practicing like 23 years ago, we had collagen fillers. So the collagen was manufactured in the cow, and it was like the fillers, like hyaluronic acid. It came in pre-filled syringes that we would inject, but we had to do testing, like allergy testing twice to make sure that the patient is not allergic to it before doing the filler. But that was not ingested, that was injected. So it's put under the skin, but otherwise it doesn't work. No. Don't waste your money.
Yep, a lot of people swear by them, though. And yeah, I suppose it depends on, because often they don't come with just the collagen. Like, I mean, your Totally Derma, which I know that people have got quite good results with, but it's got 20 different other amino acids in it, and hyaluronic acid, and a bunch of vitamins. So it could be any one of those things that in it that's making the difference, really, isn't it? So tricky.
Yeah, I
Tricky.
don't.
Yeah.
I don't know, but it's broken down in the stomach to amino acids. So, and it's absorbed as individual amino acids. So it's not absorbed as collagen. And the same thing with the vitamins. A lot of people ask me, what vitamins should I take for the skin? Which tablets? Honestly, our body needs minute amounts of vitamins. That if you're consuming a well-balanced diet, you're getting all the vitamins you need. Of course, you need to take the vitamin D. That we need to consume vitamin C maybe when we're sick to boost our immunity. um, if you're deficient in something, you need to take it. But just swallowing 4 or 5 tablets of supplements every day just to boost the skin, it doesn't really do anything.
No. What about B group vitamins for hair and nails? Biotin.
No, for hair loss, I would just do. Um, I test them. So if they have hair loss of undetermined etiology, we'll do a blood test, see if they're deficient in iron, vitamin D, folate, zinc, and then supplement them with what they need. There's no harm in taking a multivitamin for hair growth, but you don't need to take them routinely, and they're not gonna. You need really tiny amounts.
Yeah.
So
Interesting little study came out. Of course, it was done on men, but it was looking at smoking and hair loss, and linked male pattern hair loss. With the more you smoked, the more male pattern hair loss you had. And I wonder, actually, I mean, because I'm assuming then that's to do with the blood constriction, probably more than anything else. So it'd probably be the same for women, really, wouldn't it?
yeah, I haven't seen that study. I would look for it. In women, yeah, maybe if it's been scientifically proven. I haven't heard of it or seen it. But smoking, in addition to causing cancer in the lungs, in the lips, in the tongue, it also ages the skin. So it can cause premature aging. So yeah, it's one of the things that can make you age faster. So
Terrific. As if it wasn't hard enough as it is.
uh,
Brilliant. All right. I think we pretty much covered everything, haven't we?
yeah. Any more questions?
I don't think so. Let me just whiz back there. If I've ignored anybody, I don't think so. No, I think that was it. Yeah. Brilliant. All right. Well, I will let you go. I will finish this here on the Instagram now. Thank you, lovely people, on that one. And I will say goodbye to you over here. But before I do that, which I probably should have done there before, is people find you at DermaSurge on Harley Street, and
121 Harley Street, Dermasurge. It's called Dermasurge Clinic, DERMASURGE. It's on
brilliant.
21 Harley Street.
Thank you, and I will speak to you again soon.
So thank you. It was lovely. Take care. Bye.
Bye.